If you're planning to relocate and move to Jordan, you probably will have a very exciting but also very challenging time ahead of you. As with any other countries in the Middle East, Jordan is not an exception, and you as an expatriate require to have your private international medical insurance in place. For the daily medical services required, such as trips to the doctor, prescribed medication, maybe some diagnostic testing, the local facilities in Jordan won't be any problem at all. But if you require major surgeries, or if you happen to have an accident, you probably would like to have the option of being evacuated and treated somewhere else other than in Jordan. Maybe be flown to Dubai, where we all know that the medical facilities are world class. In order to be able to do this, you need to ensure that your medical insurance policy includes the so-called emergency evacuation benefit. Policies generally are designed in a so-called modular system, which means that your hospitalization treatment is covered under the hospital policy, but you can then top it up to include your daily doctor visits by adding the outpatient rider, maybe adding maternity benefits as well if you plan to have a family, adding dental, but most importantly, making sure that your policy includes emergency evacuation. It's not a benefit that all the policies automatically include. With insurance carriers such as Allianz or Bupa or IHI Denmark, you would have to explicitly add this module on to your overall coverage. This is where we in Global Assurance can help you to ensure that you choose the right insurer as well as the right combination of insurance benefits, and help you to guide your way through all the different options and solutions that are available on the market. If you have questions on your medical insurance policy in Jordan, or generally any other queries about your healthcare facilities, please contact us on Global Assurance anytime.
We've been quoted in a lot of the media around what we're doing around payment innovation. And really, in today's world, we're still largely a fee-for-service company. We pay doctors based on activity and volume, not necessarily outcomes and value. We had a big push last year to move away from this fragmented fee-for-service world and start to deploy payment models that better align incentives with us and our provider partners. Where we stand today, about one out of every 5 healthcare dollars we spend on local Florida Blue customers is related to what we call a value model, whereby us and our provider partners are rowing in the same direction to protect members' access to affordable care and improve quality. So really what we're focused on is building on the success of 2012 and further deploying these types of models to whereby by this time next year will be 1 in 4 healthcare dollars are aligned to one of these value-based payment models, and with any luck it may even be more like 1 in 3. So when we talk about value-based payment models, ACOs and medical homes and risk deals, Florida Blue has a significant lead in the Florida marketplace. You know, we obviously watch what our competitors, the Aetnas, the Uniteds, and Cignas are up to in other parts of the country, and they've had some success there, but no one can really touch where we are in the state of Florida. And it's interesting, it's creating a new value proposition for our sales organization, because the old days of quoting on a piece of business and talking about how big and broad your networks are and how deep your discounts are, that's starting to change, and a lot of the more advanced and sophisticated brokers and consultants out there are actually more interested around trend and risk-adjusted PMPMs, because we're teaching our sales folks kind of a new value proposition, and that is the best discount you can get is actually on the claim you avoid altogether, by keeping your employee healthy and out of the system altogether. And by working with our provider partners through these new value-based payment models, we have financial incentives for the providers to do that very thing. They're not solely focused on volume equals revenue, they're actually focused on value and actually getting paid more for technically doing less. Well, interestingly enough, most provider organizations fully understand that we're on an unsustainable path and that there is a true crisis of affordability in the marketplace. So most providers know they have to change and evolve. So when we talk about population health management, patient-centered medical homes, accountable care organizations, the provider community has really embraced this concept with very limited exceptions. There are a few out there that have decided to stick their head in the sand and hope that healthcare reform and this whole affordability issue goes away. But generally speaking, whether it's myself, Dr. Gavris, Joyce Krams, or Brian Kiss, or even Patrick Garrity, when he's out there talking to providers, it's amazing how aligned our visions of the new world are, and we all recognize that we have to change and evolve, and that ultimately we have to interact with each other in ways we haven't before. We have to leverage the voluminous amount of data that Florida Blue sits on and turn that data into actionable information so that our providers can actually improve the quality of care rendered, keep people healthy and productive in the workforce, and protect affordability. Florida Blue is viewed by the association as one of the thought leaders in this space of value-based reimbursement, and we work closely with a lot of our sister Blues plans to help them understand the types of models and the success we've achieved in the Florida marketplace. Ultimately, a lot of our success has been on our locally administered Florida Blue members, but to really move the needle on healthcare value, we need the Blue Card members to come along for the ride. And to make that happen, we have to work really closely with our sister Blues plans to make sure we have the necessary data to do attribution, which tags patient to doctor, to risk adjust populations, which means we need a lot of demographic information and historical claims information on those Blue Card members. So we're actively working with the association and our sister Blues plans to make sure that data exchange is happening in a way that allows us to deploy these value-based payment models across all lines of business, all funding arrangements, including Blue Card.